Hello dear viewers, hello dear friends, welcome to my YouTube channel Naeem Videos. Dear viewers, I hope you all will be fine and doing well. Dear friends, dear viewers, here in this video I will discuss an amazing topic of the use of PPE, that how you can use PPE, how you can use personal protective equipments. In the previous videos I had discussed standard precautions, I had discussed isolation, transmission of infection and chain of infection, components of chain of infection. But now here in this video I will discuss the use of PPEs, use of personal protective equipment. But here I kindly request you, if you are new on my YouTube channel or you have not yet subscribed to my YouTube channel, then I kindly request you to please subscribe to my YouTube channel Naeem Videos and press the bell icon. So in the use of PPE, the first thing is gloves. Gloves needed if coming into contact with fluids. You should wear gloves on your hands if you are going to contact with fluids, like you are going to contact with vomits, you are going to contact with come in contact with stool, come in contact with urine, mucus and blood. You should also wear a gown, so the gown is needed if there will be a potential contact with fluid or blood on clothing. If there is a chance that your cloth must be contaminated through fluid or blood, then you should wear gown. Goggles, face shield and face mask. Google face shield and face mask is needed if there will be a potential contact with fluids or blood in mucous membranes. For example, if the patient is coughing, vomiting while providing a suctioning or mouth care, so in this condition you should wear a Google's face mask and shield to prevent the contamination of your face, especially your eyes, nose, mouth, and other areas of the face. There are another types of precautions which is called transmission based precautions. So transmission based precautions may be needed in addition to standard precautions for selected patients who are known or suspected to certain infections. These precautions are divided into three categories, which is the contact precautions, droplet precautions and airborne precautions, that reflect the differences in the way infections are transmitted. Some diseases may require more than one isolation category. The types of isolation: patients are isolated according to the mode of transmission of the disease. There are round about 11 types of transmission of the patient in relation to the disease. The first one precaution is the first one isolation is contact isolation. The second one is droplet isolation. The third one is respiratory isolation. The fourth one is strict isolation. The fifth isolation is enteric isolation. The sixth one is protective isolation. The seventh one is wound and skin isolation. The eighth one isolation is blood precautions, while the ninth one is the discharge precautions. The contact precautions, here we will discuss it one by one. The contact precautions are direct and indirect contact precautions. Is the most frequent route of transmission of hospital-acquired infection, nosocomial infection. Direct contact transmission occurs when there is direct body-to-body transfer of microorganisms between an infected or colonized person and a susceptible host. Indirect contact precautions or indirect contact transmissions occur when an inanimate object, such as equipment used on the infected person or unwashed hands, serves as a vector of transmission between the susceptible host and the infected person. Recommendations for contact precautions: place patient in a single room, put on a gown and gloves before entering the patient room, remove gown and gloves just inside the door to the patient room, and discard within the room. Wash hands thoroughly after gloves and gown removed. Dedicate equipment to the isolated patient. Recommendations for contact precautions: if this is not possible, equipment must be disinfected before being used on another patient. The patient must remain in the isolation room at all times except for essential tests or procedures that cannot be performed in the room. The patient must wear a cover gown and gloves when out of the room. Recommendation for contact enteric precautions used for patients with Clostridium difficile associated disease. The recommendations for patient care include all of the above recommendations for contact precautions, but in addition, hand washing with soap and water is required when caring for patients with Clostridium difficile associated disease. Clostridium difficile is not eliminated by alcohol based hand rub products. Alcohol based hand rubs may not as effective against spore forming bacteria. So this is all about our today video. I hope you will like my video. I hope you will understand my video. If you are new on my YouTube channel Naeem videos, then do subscribe, like and share my videos.